causes people to want to harm or kill themselves?
Okay, so self-harm, but especially suicidal ideations, suicide attempt, suicidal gestures. Perhaps we should define all of these things. So suicide is a completed death inflicted by the self, and it's a completed attempt of dying, and the person died. That is a suicide. Suicide attempt means trying to kill themselves, but the person didn't succeed. They survived the effort. Suicidal gesture is a interesting term because it's like behaving as if they are going to want to try to kill themselves, but they actually didn't go all the way to attempting it. For example, holding a knife or holding a bottle of pills, but they didn't actually ingest it. But that is serious as well because that could have taken that person's life. Suicidal ideations means having the thoughts or thinking about death, wanting to die and not survive it, wanting to passively die, for example, not eating and maybe just dying from that, or walking across the street, and if I get hit, I get hit. So those are all encompassing what we call suicidality. So the actual suicide frequency or prevalence is the second leading cause. This is so alarming. Second leading cause in children, adolescents, and young people, young adults, especially ages 15 to 24. And the only thing that is number one compared to that is accidents, not even illness, cancer, or murders. So being second leading cause that could have been prevented is a very alarming statistics. And majority of those who complete suicide, like attempted and complete, are suffering from a significant mental health disorder. Over 90% of them are struggling either with depression or major anxiety disorders or other kind of disorders like bipolar. And we call them in this category of mental health disorders. And a lot of times what leads them all the way to attempting and succeeding is hopelessness, helplessness, worthlessness, and that overwhelming despondency and depression that makes them say, you know what, I'm going to end it all now. And they forget about anything that they had reasons to keep them alive until then. And sometimes in children and adolescents, people commit suicide and it was an impulsive act, which is a very alarming and dangerous fact. But what I mean by impulsive, meaning if they were to really think about it, maybe they could change their mind. But a lot of young people are already impulsive because their frontal cortex is not fully developed and they don't judge the consequences. But anything like sadness and confusion, anger, anxiety, stress, sudden pressure that they feel like they cannot escape, or sudden shame and guilt. A lot of those things can trigger this impulsivity of, you know what, life is not worth living anymore. And then they can go to attempting to hurt themselves or attempt to die.
How common is it for a child to have these feelings?
I can't really say like these many kids are thinking about it right now, right? But more commonly, it can occur if there's a family history of suicide or attempts. So this is something to really be aware of. If the child is going through a constantly toxic environment, for example, bullying or being exposed to violence, even at home or in the community, sometimes acute rejection or persistent conflicts with their parents, because that really does hurt, or their caregivers, or problem after problem after problem, that can increase the likelihood that somebody would want to have these feelings or have these feelings.
What can parents or teachers do when they hear a child talk about suicide or self harm?
Oh, wonderful question. I would say there are quite a few who avoid because it is such a difficult topic and they just kind of wish it just kind of passes, right? But I would say number one is really engage, to not avoid it, be willing to ask direct questions, and not be afraid of asking it directly, with the readiness to listen and not cut them off, providing assurance that you are capable of a caring conversation. Sometimes they want that. They want someone to acknowledge it and bring it to the surface, meaning bring it to the consciousness. Direct questioning, for example, is, are you sad? Are you so sad that you don't want to live anymore? Those are okay to ask. And then also, secondly, is to avoid, even though you might be really anxious, to try to avoid showing that, appearing anxious. I know that might be a lot to ask, but we, as parents and caregivers, teachers, we can be very fearful, or ashamed. So we want to help validate and normalize that those feelings can come and go, but to be able to go into conversation deeper. Well, how long have you been feeling that way? Did something happen and then now you're thinking that? Like, all of these questions can be asked. I don't know if time permits for me to just show and share all of the scripts that you can, but that's a good start right there.
When do we know when it's serious?
I would say anyone, even if some parents think, oh, they just want attention, of a child saying, I'm gonna kill myself, I should just die. I would say even if it ended up being an attention grabbing statement, I would say all of those comments are serious because that's not normal. Even as an attention grabbing statement, it's not normal to use those words. If they're using it for attention, I'll start off with that. That means they really want to get your attention and they haven't gotten any other way. That's one possibility. But oftentimes, because it's related to a mental health condition, like major depression, anxiety, all the ones that we've talked about, we have to find out the underlying psychological reason. Perhaps there isn't a diagnosis already, but what's going on in the social environment and psychologically in the child, we have to figure out what is causing that person to feel, even a child, right, to feel so hopeless that the answer is death. So treatment, when we try to find out and we try to help the child understand their own cognition, meaning their own thinking, something called psychotherapy is needed. This is not a regular counseling, but a skilled clinical psychologist or psychotherapist in engaging with the child to figure out not only why do you want to kill yourself, but if there is depression going on, social phobia going on, is there domestic violence in the home going on, all of these kind of issues to find out during those sessions. And also, if there are certain thinking pattern issues, I'll give you an example. Borderline personality disorder or some of the other personality disorders have a higher tendency of using the word suicide or I want to kill myself or self-harm as a coping mechanism. So there are certain types of therapies just made for that. And lastly, if it's a major depressive disorder or bipolar disorder or generalized anxiety disorder, panic disorder, some of these really do need medications to help stabilize the neurological problem. Otherwise, that's always going to constantly drive the person to think those certain patterns. That sometimes includes suicidal thinking. So a psychiatrist or a nurse practitioner or a very, very skilled pediatrician would be a good person to seek after. And then lastly, for treatment wise, we cannot forget, because this is also Mission for Christ, teachers call this, the spiritual aspect, right? Ongoing, constant teaching and reminding of their identity. And if they're not sure, to realize what their identity is, either a child of the devil. I mean, that's hard to do, right? You're a child of the devil. So, but letting them come to the knowledge and saving knowledge of Jesus Christ, to know their true, new, restored identity as a child of God, and therefore all of the blessings that come with that, which includes meaning and purpose. So if they know that God has placed them here for meaning and purpose, even though they're a young child, then how could they be the one to try to kill themselves off, right, before that meaning and purpose is fulfilled? Meet them where they're at in explaining those things.